Well, good morning and welcome to today's webinar, Understanding Alzheimer's and Dementia, presented by Ms. Ellen Perticone, Certified Dementia Practitioner, Senior Specialist, and owner of Senior Placement Navigators. My name is Jeff Stauffer, Community Relations Director with Elville & Associates, and I'll be moderating today's event. So how this will work today, if you're new to our webinars, if so, welcome. We're glad you're here. You as the attendee are in listen-only mode. However, if and when you have questions, please note them in the questions panel on the right-hand portion of your screen, and we'll take time halfway through and at the end to address your questions. Your questions really help the presentation and add value. They help others learn greatly, so please don't be shy in posing your questions at any time. So as many of you know, I always send the presentation out ahead of time. However, this is an interactive presentation with many videos and media elements, so I was not able to do that at this time. So the presentation is very comprehensive, and I'm sure you'll get a lot out of it today. Everyone will also receive a post-webinar feedback email right after the presentation, and we do ask that you please take just a couple minutes to fill out the simple survey to offer us your feedback about the presentation. Our firm works every day with families that are addressing situations with loved ones with Alzheimer's and dementia, working to create solutions to sometimes challenging situations that have many layers to them. So please reach out to us if we can be a resource to you now or in the future. And we always work with the ideals of education, collaboration, and compassion in mind with every client, every time. So at this time, I'd like to offer a proper introduction to Ellen. So presenting will be Ms. Ellen Perticone, Certified Dementia Practitioner, Senior Specialist, and owner of Senior Placement Navigators. Ellen founded Senior Placement Navigators with a background in independent senior living, assisted living, private duty dementia care, and senior living placements. Helping her own family many years ago was Ellen's first introduction to what became her next career path. The experience inspired Ellen to use her people skills and business experience to help other families in similar situations. Ellen is passionate about helping seniors and their families. She holds a degree in business communications from Stevenson University and spent several years in the business world. When not working with seniors and their families, Ellen volunteers as a community educator with the Alzheimer's Association. She holds educational presentations on a variety of topics related to dementia and Alzheimer's disease. Some of Ellen's other interests include animals and travel. So Ellen, thank you for being here and welcome back. I believe you were the first presenter when we kicked off the Elville Workshop Series in January of 2020. So it is a pleasure to host you again. So I will turn it over to your capable hands. Thank you.
Thank you, Jeff. Good morning, everyone. I'm delighted to be here to share this presentation of Understanding Alzheimer's and Dementia through the Alzheimer's Association. As Jeff said, my name's Ellen, and I'm here as the role of an outreach educator, but I do want to share that, you know, with my experience of being in the field and working with people with dementia and working with families, I hope to kind of bring some of that to the program as well, because dealing with this disease takes a little navigation. And the local office here is Maryland, the Greater Maryland office, who I am out of. So this program is designed for those who are interested to learn more about Alzheimer's and other dementias. And it features information from dementia experts and perspectives from individuals living with the disease and their care partners. Care partner is a term that many prefer over the term caregiver in the early stages, because many times at the beginning, people don't need much assistance with the daily tasks, but they really benefit from the support of family and friends. So like Jeff said, this is not, you all are muted right now. What we will do is stop midway, and hopefully if you have any questions, and I welcome them all, and we can address some and then when we're finished. So today we are going to look at a top level look at Alzheimer's and dementia to give you a broad understanding. And by the end of today's program, you will be able to compare Alzheimer's and dementia, recognize how Alzheimer's disease affects the brain, list the risk factors of Alzheimer's disease, identify the 3 stages of the disease, recognize the current FDA-approved treatments that can address some symptoms from the disease, and describe how scientists are working to advance research. So there are several resources available through the Alzheimer's Association, and we will talk about them as well.
As we get older, cognitive problems become more noticeable for almost everybody. Typically with age, people have trouble coming up with the word they want, write what they wanted, and trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently. And the words or names don't necessarily come to them later. And then they start displacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that might be the beginning of a memory problem.
So normal aging versus dementia. Alzheimer's and dementia, what's the difference?
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain, that includes the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
Risk factors.
Alzheimer's disease is marked by specific brain changes that result in clinical changes. That is, changes in memory, thinking, or reasoning, and ultimately Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. When we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are 2 categories that can potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop.
So I will say this before we go on to the next slide, is that it is, you just heard that Alzheimer's and dementia are not a normal part of aging. And what determines that is that not everyone gets it. We know as people age, their skin changes, their hair changes, all these different biological things change. But since not everyone will get dementia or Alzheimer's, that is not a normal part of aging. So talk about the population at higher risk. So Hispanics are about 1.5 times as high likely as whites to develop Alzheimer's and other dementia. African Americans are twice as likely to develop the disease as whites. And almost 2/3 of Americans living with Alzheimer's are women. It is still undetermined why this exists. There may be theories, and this is part of why there's so much information coming out and studies being done, specifically with something called trial match, to see how these things occur and why. So now we're going to test our knowledge a little bit about what we know about the disease. Oh, I just told you the answer. Alzheimer's is a normal part of aging process. Well, if you understood what I just said, you know the answer is false. I got ahead of myself. So here's another one that is good to know. What are the greatest known risk factor? Genetics, family history, or age? So just kind of test yourself and see if you know what it is. And the answer is age. So the older a person gets, the higher their risk is for developing Alzheimer's and dementia. It is not that family history is a risk factor, genetics is a risk factor, but age is the greatest risk factor. So that is the differentiation there. Some of the warning signs. So we're going to talk about the warning signs, and so that people can appreciate and understand what the differences are. Memory loss that interrupts daily life. And what that means is this. As people age, there is a slight change in their ability to retrieve information. That is not abnormal. But when a person is missing appointments, not just losing their keys, but they find their keys in the freezer, that is memory loss that interrupts daily life. Challenges in planning or solving problems. That's the executive functioning skills. And being able to logistically sequence. That is where it shows up as well. Difficulty completing familiar tasks. So an example of that would be if someone is following a recipe and cooking something that they are familiar with, but they cannot follow the sequence of the directions on the recipe and what they have done and what they need to do next. Confusion with time or place. So that is a big one. Sometimes people don't know where they are or why they're there. Or one of the classic questions is, what year is this? What day of the week is this? Trouble understanding visual images and spatial relationships. So sometimes with the disease of dementia, people have trouble walking. And the walking comes from things like depth perception. When we see a curb, we would know, okay, we prepare to step down or step up. And that is where the trouble comes in. And when people fall, sometimes it could be related to something like that difficulty that is new. New problems with words or speaking or writing. And word retrieval is one. Using proper nouns versus pronouns. I see that a lot. Instead of naming them, they'll say they, things like that. Misplacing things and losing the ability to retrace steps. So obviously, that's what we do. We misplace things. We think, okay, where was I last? When did I last see this item? When did I last use this item? We could, our cell phones, right? When did I last use this? You will work back in time, and if you lose that ability, that is a sign. Decreased or poor judgment. A traditional, not that means anybody who gets scammed has the disease, but it is not being careful enough to say, I don't know that this is the right thing for me to do. Let me check with someone. and making poor judgment, withdrawal from work or social activities. So a lot of times people who are exhibiting early symptoms, I think they recognize that something is amiss, something is different, something is not the same. And for them to follow conversations and not repeat themselves is something that is going on. And so to save themselves embarrassment, and so not to have to deal with what is going on, they would withdraw, because it must be very frightening not to be able to understand what is going on. And changes in mood and personality. That does occur, and the key thing is changes. And that is really something to look for. So let us move on. And
Ellen,
yeah.
This is Jeff. You mind if I interrupt you for just 10 seconds?
Sure.
So I got some feedback that the videos were a bit difficult to hear the first time around. Is there any way you can easily turn your computer volume up so that may help the video sound this time around? I would say to the attendees that if you do turn your speaker volumes up, it should help with that as well. But Ellen, if you're able to turn your volume up, it may prove helpful too.
Okay, I'll do what I can. So it's possible for individuals to experience one or more of these signs in varying degrees. It is not necessary to experience every sign in order to raise a concern. So if you notice one or more signs in yourself or another person, it's important to see a doctor. And the Alzheimer's Association has the simplest website. It's alz.org. That will take you to a menu of lots of things with Alzheimer's organization. And there is more to learn about the 10 signs, the 10 warning signs. And you know, and we will go through what a diagnosis looks like and how one deals with that. So the importance of early detection and diagnosis, that is a big important thing.
There are a number of benefits of early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Also, the treatments that are available for Alzheimer's don't cure Alzheimer's. They don't slow down the disease, but they do help with symptoms. And it seems as though they tend to work better the earlier a person is able to use those. So that can help too. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
So I hope you can hear a little bit better. Now we're going to talk a little bit about the Alzheimer's Association resources that are available. One of the key resources that is out there, and I highly, highly, highly encourage everyone to write this number down and to use it. It is the 24/7 helpline, and it's up on the screen, 800-272-3900. I've used it myself, and it'll tell you a little bit about it right now.
I've had a couple of phone calls that I've been able to make in to the call center when I've had a couple of quick questions that I wanted to ask. You know, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did, was keeping the call center on my favorites now. just to know that there's somebody you can call who is aware of what you're going through.
And I'll just say something else about this helpline. I used it. I was working with a client and their family, and their way of dealing with their father who had dementia was just seemed way out of line. And it was really an ethics issue, and I wasn't sure what to do about it. So I left a message with the call center. They called me back. What they will have are trained people who have a master's degree or higher. So they really do know what to do. And the person walked me through it, and we talked about it, and it came to a resolution. I just recently gave this phone number to a colleague of mine who has a business, and in her business, she suspects that one of her employees has got dementia and really was struggling with how to handle that and how to talk to him or his wife. I suggested, call this helpline. They will guide you through it. So it's out there, it's free. Why wouldn't you use it? Here's another resource right here.
When I went to the Alzheimer's Association website, which is alz.org, then I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how many people are affected by this, where can I go for resources, where can I go for help, what do I do with this, how can I handle this, is there more people like me out there, is there someone that I can talk to if I need to? And there I found the support line. It's 24 hours a day. Here I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
That's true, what Teresa said. So I will just share with you a couple of brief things that the Alzheimer's Association does offer, and I cannot recommend it enough. First of all, there are support groups, and I've been to them. I encourage anyone to go to them. People I talk to sometimes feel like, oh, I'm too private, or I don't want to hear people complaining. Well, it'd be good to try it first. First of all of them are facilitated by someone. So there is an agenda, and that way it doesn't go off track into just endless complaining. That is not the purpose. That is not the idea. When I talk to families and I share with them, look, there might be someone who has dealt exactly with what you're dealing with, whether it's logistical, whether it's financial, whether it's with your feelings. And maybe they have solutions that they've tried and worked, or maybe things that haven't worked. And this is a great resource. So since COVID started, this has been going on online. And normally it's in person. And so down the road, it may be a combination of both or either, I'm not sure. But that is a great resource, the support groups. And that is out there for really the families. There is another support venue that the Alzheimer's Association does facilitate, which is called the Memory Cafe. And that is held for the person with the disease in the early stages and their caregiver. So both people would go and they would have a little meeting, and then they'd separate. And the people with the disease would go together with a facilitator, and the families would stay together and they would have their meeting. And it's just a way to continue to engage both the person with the disease and the care person about what we're going through. So that has a lot of value. The other thing the Alzheimer's Association offers, I know in the Maryland chapter, is there's a social worker that you can talk to, and that is a local person. It is there for your help. So there's a lot on the Alzheimer's website, and now we'll see what is going on in communities nationwide.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time, or if I'm struggling to find some resource, that they will provide that to me.
Ways to join the fight. So we're going to look at some of the ways that you can get involved if you are interested. One of them is obviously volunteering. That's what I'm doing right now because I can, and it really helps me stay on top of my game, and I can give back in a way. I'm happy to do it. What I find in this journey with families dealing with Alzheimer's and dementia is that nothing really prepares you for this. And so it's really good to be able to have resources to help walk through this journey and to make it easier. Advocacy. There is a lot of work going on in the legal aspect in Annapolis, and that is a way that people can get involved if that is what they choose. Trial match. Now that's a very interesting one. Everyone can help by participating in clinical trials. So when they do clinical trials, they will work with people with the disease and people without the disease. And it's free, easy to use. The website, it's all starts with alz.org, but it's a way to find out how one can make a difference. And what we have coming up is the Walk to End Alzheimer's. So more than 600 walks, register for awareness. So typically the walks are held in the end of the summer. So like September-ish, there's about 6 walks in this Baltimore metropolitan area. What they are doing this year, which I think is awesome, is they are holding walks which are both online and in person. So depending on your comfort level, either way is fine. There is no charge to participate in a walk. Registration is required, and you can form teams. You can be part of a team. You can just walk on your own, but it's really a way to really participate and help bring awareness, which is one of the missions of the Alzheimer's Associations. It is awareness, it's education, and it is also research. And the longest stay. So the longest stay is the summer solstice. And this is another fundraiser that they hold. And there's information on the website about that. So there are a lot of ways that a person can get involved if they wanted to. What I love about volunteer work is that you can participate as much or as little, and in whatever kind of environment that feels comfortable for you. So we love volunteers. So questions are for the 800 number. We have that. We're going to stop right here. And then we're going to go on to the introduction to Alzheimer's, because what we just talked about now were some of the 10 warning signs. Now we're going to go into the introduction to Alzheimer's, and so you can get a better understanding of a broader view. We already talked about the normal aging versus dementia. Alzheimer's and dementia, what is the difference? We talked about the umbrella term of dementia. Dementia means cognitive impairment that interferes with daily life. So under that umbrella, Alzheimer's is one of them. there are different kinds of dementia. Most dementias in this country, 60 to 80%, are Alzheimer's. So that's the reason that we focus on that as well. And the risk factors, as we talked about, are age, genetics, and family history. Oh, I think we were repeating ourselves here, but I didn't mean to. So let me see if we're, oh, no. Bear with me 1 minute here. I don't know if there's a glitch. Oops. Here, we'll try this. This might be a good time for questions. Jeff, do we have any questions so far about what we've talked about?
Sure, thanks, Ellen. And it looks like we do have a couple of questions.
Okay.
And the first question is, what is normal for retrieving information? What about people's names? Can you please give an example?
Okay, be happy to. So, I remember growing up, my mother never got our names straight. Kathy, Ellen, that's kind of funny. So, like we mentioned before, there are, as one ages, the retrieval is not as quick. But when you cannot later on remember what you have, you know, there's someone's name and you're like, gosh, I can see them in my mind's eye. I know that person. And usually later on you can remember who they are. Okay. But if there's someone that you can't recognize, or you have no idea how you know that person, or they say that they know you, but you don't see that, that would be an example of the difference. And certain word retrieval is not as quick as people age, but if you are substituting the word grapefruit for lamp, there's a big difference there. So it's a matter of degree. One thing that this did not talk about, and I will share about, there is a condition called mild cognitive impairment. And it is, for short, it is MCI, mild cognitive impairment. And what it is, and it can be detected with a screening with a doctor, a gerontologist, or neurologist if you ask for a screening. And mild cognitive impairment does not mean you have dementia. It does not mean you're going to get dementia. It could mean that, but it could also mean that you have mild cognitive impairment, which again is usually might happen with aging, but Alzheimer's disease is progressive. And maybe that helps explain a little bit, answers that question. Anything else, Jeff?
Yeah, one more question. If you could please review the normal aging versus dementia portion one more time briefly. Had a couple people that couldn't hear all pieces of the video, if that's possible. Thank you.
Very possible. Right, let me go back and find it. Yeah, I was able to turn it up, and I guess that helped. Did that help?
Yeah, and so I'm just going to say real briefly, you know, I'll be sending the video out from today, and so hopefully, if you might be having some connectivity issues, that you can go back and review on the video what you may or may not have heard. I know that, you know, sometimes it's dependent on your device and internet connection, and you know, we obviously always try to provide a good experience here on our webinars, but in the age that we're living in, sometimes connections and issues like that arise. So I think we have it all ironed out, of course, and I can hear you loud and clear, Ellen. So hopefully everybody else can as well. So I think
all
we're
right,
in good
well,
shape.
I'll just read some of this. All right, we'll see. So we can hear it. Here we go. Oh, no, I didn't mean to do that. Can we not hear her? Oh, now what happened? Jeff, can you hear me?
I can hear you, yes.
Okay. I just tried to play that video and I couldn't hear anything. Could you?
I could not.
Okay. Okay. Let me just go back real quick one more time. I apologize for this.
Not a problem. Not a problem at all.
I'm not sure what just happened. But as I'm going back, what I can talk about, and I think this might be helpful for people in general, how a diagnosis is made. And this is from my experience. This is not part of this presentation, but I'm going to share it anyway because I think it could be helpful. Dementia and Alzheimer's, there is not a clinical test. So it's not as though you can go to the doctor and get a blood test. So it is really a series of elimination. It is a process of elimination, documenting symptoms, and relaying this to the medical professionals and eliminating other things. So the first thing that I would suggest someone would do is if they notice that things are off or different, start documenting. Whatever, date, time of day, what's going on, how the person is, what is going on, and keep as well documented as you can a journal of this. Because to say, well, sometimes they do this, well, that's not as helpful as in the past 3 weeks, I've seen this occur 4 times, and it's usually at 4 in the afternoon. That's way more specific. So documentation is really helpful. The other thing that is important in the first piece is to go to either an internist or a gerontologist if one has one, and get a full physical with a full lab blood workup. The idea is to eliminate other possibilities, because whether it's confusion or forgetting or whatever it is, sometimes medication reactions, urinary tract infection, there could be different things that may present as something like early symptoms of dementia, and it may not be, or there might be something else going on. So it's really important to get vested in that. After that is completed, what I would usually a doctor, and if your doctor can't, the Alzheimer's Association can refer you, or you can ask your doctor if they can give your loved ones screenings. And these are verbal screenings. These are questions and answers. Sometimes it's just a conversation. One of the classic ones is someone to draw a clock with the hands. That can be revealing, because that can be done and compared down the road and then further down the road. So the diagnosis is a process of elimination. So want to make sure it's not other things that present, other medications. Maybe there's something in their care that needs to change. It could be something else. So the documentation from the family. Another symptom and it wasn't part of the early warning signs, but on a practical matter, when people get to the point where mail is piling up, they're not answering mail, or you see on their pile of mail all kinds of solicitations from all kinds of outfits, that's a little concerning. If there are mistakes in the checking account or problems with the checking account, because the ability, those skills to sequence and do the math could be compromised. So those are things to look at. If someone is, if someone's disheveled, so what the thing of it is to see, well, if they were always disheveled for the past 50 years, they're probably still going to be disheveled. But if it was a person that was not, and what we're looking for are changes, right? And people who might wear clothes that would be from a different season with no real reason. Those are things you look for or pay attention to. And when you talk to someone, you just ask them gently and kindly. And it's really hard to be patient, and it's really hard not to be frightened. And that's where the support groups can be helpful, and the 1-800 line can be helpful. So those are some things I think I would put in there as well. Now I'm going to get back to where we were. Let's see.
Ellen, could you perhaps just offer some general comments, or do you have notes about reviewing normal aging versus dementia as opposed to the video per the gentleman's request?
Sure. Yes, I'll be happy to. So we're going to look at someone who is a senior and think about what would be normal for them. So in other words, let's say there's a woman and she always did her own shopping and marketing and house cleaning and everything. And so now she's getting older, and it's not as easy to do the laundry. It's not as easy to pull it in and put it out, but they might not complain about it. Or it's not as easy to go shopping, lug all the groceries home, put them away, cook a meal, clean it up, do all that. And so that might be, okay, so there could be changes there. So what I think is important is to recognize that, well, maybe Granny's not up to all this anymore, and Granny doesn't want to lose independence. So if you see things that are neglected or the house isn't clean, that just might be because physically it's just a lot of work and it's not fun. And so those are things that you can talk about and are understandable. Well, maybe we can have someone come in and clean for you. Maybe my cleaner can come in and clean for you, that type of thing. But when people, like I said, lose their train of thought in the middle of a conversation, or their keys are in the freezer, or all of a sudden they show up in July wearing winter clothes, that is not a normal little glitch there. That is something that maybe someone has got some issues. And again, the really only way to tell, and if there were specific things, we'd be happy to talk about it, but the certain things like losing your keys, losing your cell phone, okay, that happens to everybody. Now, some of us are better than others at keeping track, but on occasion this happens to a lot of people. That is not the thing to worry about. When you see someone you know, but you can't remember who they are, that is a big difference there. So it's that type of thing. Or let's say you go to a meeting every week, whether it's a church meeting or a bridge group or whatever, and now you're not going, you're forgetting. You're forgetting something that is already in your schedule. That is something that is not necessarily typical. And that's something I'd pay a little bit closer attention to. So I don't know if that helps. I hope it does. And that's when the other things that I mentioned about documenting, talking to the doctor, getting screened for eliminating other things, those would be the steps to take. So I hope that makes a difference. Let's see what this has to say. I don't think we'll play this again. Oh no, now I don't hear it. Do you hear it, Jeff?
I don't hear it.
Oh my gosh.
Double check your sound on your computer, possibly.
Yep. It's up to,
doesn't look like it's
no, he's not even
moving
talking
forward either.
Oh gosh. Okay. All right. Let's try one more. Let's see.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning.
I'm not sure what's going on.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
So I hope that came through okay, louder than the first time. What I would like to say is there are stages of Alzheimer's disease, early stage, mid stage, late stage, and they're kind of put in categories like that so that people and the families who work with the person with the disease understand what to expect, how to prepare, how to mentally prepare and emotionally prepare. Because some people say, oh, well, what's the point? There's nothing we can do about it. Well, here's a couple ideas. No, we cannot stop the disease yet. We cannot prevent it yet. And we can't make it go away. However, the journey is really, it's hard for the person with the disease, but it is almost harder for the families who are their caregivers and caretakers. Getting your head around the disease and understanding that when the person exhibits different behaviors and acts different, it is not them, it is the disease. And how we react to it and how we cope with the family member and how we do that for not only them, but for ourselves too. It is huge. It is a completely different mindset because the idea is we go where they are. They can't come to where we are. That's not going to happen. So to say things like, don't you remember? I just told you that. You've done this 100 times. That is so counterproductive. And for most of us, that's what would come naturally. And about getting things like that, that kind of vocabulary, that kind of thinking out of our minds. If they remembered, they wouldn't ask you. I remember one time that I was a companion with someone with Alzheimer's, and we would have great long conversations. Well, she would mostly. And she would ask me what time it was, and I would tell her, and she would do this frequently, and I would just tell her what time it was each time. And she said, "Did I just ask you that?" And I just smiled at her and I said, "Yes, you did." And because there was no point in getting upset. She wasn't doing that to ruin my day. And it's difficult when it's someone who's close to you, someone you have a history with, someone who is a different person, and now they're changing in front of your very eyes. And so early detection, tapping into the resources that are available really makes a huge difference. The person with the disease still knows the feelings of feeling secure and feeling loved, and they still know gentleness and kindness and patience. They might not remember words for things. They might not remember that they just ate a meal and are asking for more food, but they know if someone's going to be kind to them. And that is one of the biggest things. And so to be prepared for that emotionally and logistically, because the person's changes in several ways on this journey, it is really, really helpful, important, and it would just makes life so much easier. So like the Memory Cafe, that is for people in the early stage of the disease with their care partner. Beyond the early stage, and these can overlap. I mean, there's no super defined things, but there are standards that one can work with and one can learn about. And it is really to help the person with the disease and help the care members, the family members. I talk to families all the time, and sometimes they're understand it, and sometimes they have to kind of learn how to look at this differently, because ultimately they're going to be happier, and so is the patient. The person with the disease makes a huge, huge difference on this journey. So that, and then so then there are, okay, so age is the greatest risk factor. So people over 65 have a greater, obviously greater risk of getting dementia. But I've seen younger people, I've seen people in their 40s with it. And there are the same things that all the doctors have been telling us for years and years and years for many of our conditions. So much of that is true with what can we do to protect ourselves. Some of the things that I have read and seen: get plenty of sleep, healthy diet, right? All those things, exercise. But one of the things that is a little bit unexpected, but equally as important as the diet and the exercise and the sleep, is continued socialization. That seems to be just as important as the other things that I mentioned in helping people stay cognitively connected, whether through their organizations or clubs or card games or whatever it is, makes a difference. It really does. And as people age, what makes it difficult for them is oftentimes they're not able to drive anymore. And if they're living alone and they're isolated, that's probably not in their best interest. Even though they might be capable of doing things, but if they're not driving and they're living alone, it's kind of an isolated existence. Now, if they're totally plugged into social media and they're on the phone and they're very busy and socially and active, that's great. But more often than not, that is not what occurs. And it's something to be aware of, something to think about. So I'm trying to work out what's going on with these videos. So I appreciate your patience. Let's see what else we've got here. Normal part. Okay, so we did talk about that. So one thing I'll share with you about genetics. earlier on the slide, Dr. Snyder talked about deterministic genes and risk genes. So can a person get tested for that? Yes. Is it recommended? No. If someone wanted to get tested to see if they had determined, risk genes are the genes that say, well, you could get it, you might get it. And deterministic says you will get this. And since there is not a cure, and since we don't have medications that slow down or stop the disease, that is not recommended. But like in all cases, talk to your family doctor. That's really important to do that. Family history, they know that if there is a sibling or a parent who has a history of the disease, you're at greater risk. And what does that tell us? Okay, it gives us information. It says, okay, even though I hate to exercise, I can see that I am at greater risk than the general population. I can do what I can to avoid this. I need to get in gear and get in an exercise program and make it part of my lifestyle. If I'm not eating right, or I don't know how to cook for one person and I'm living alone, how am I going to integrate my lifestyle into being very careful and having the best nutrition? Those types of things. It's information, it's knowledge. Knowledge is power. And those are awareness that what do we need to do? What can we improve in our lifestyle? What could we ramp up? Because this is what we know at this point. And of course, age, which we can't do anything about. So that's why it's good to know what we can do for ourselves. The warning signs. Okay, we'll go over, we went over this already. And are there any particular questions about any of these warning signs? Because if there are, we can address them. Jeff, have you gotten any other feedback?
Yeah, we do have a few questions at this time. Ellen, would you like to address some of those?
Okay, sure.
Okay.
Yeah, sure.
So, is there a known connection between sleeplessness and Alzheimer's or other dementias?
I did mention that, and I will tell you, in this presentation, this is not part of that, but I will share with you that I personally have read, because I read a lot about this, and I really try to stay abreast of it, that I have read that there is a connection. Is it proven? I don't know that it's actually been proven, but I think that there is a correlation. So when, we burn the candle at both ends when we're younger, or we can do that, I think that that's something that I'm paying attention to. I'm making sure I get enough good sleep, not just so I'm not grouchy, but I want to stay as healthy and aware as I can. And if you think about it, if you're sleep deprived, how sharp are you anyway? Your reaction time is going to be slower. With driving, it might be, easier to forget things. It's not as easy to multitask if you're sleep deprived. So that is something that I personally pay attention to. Yes.
Okay, next question is, can you talk a little about early onset Alzheimer's or dementia?
Yes. So early onset is when people are younger than 65, and that is not typical. And I think that's what you mean. Younger onset is, or we don't know for sure if that's what the question is. I think that's what the question is, because there are 3 stages, but that's in any event. Younger onset, early onset. I do know that happens. And so when someone's younger, excuse me, that you're not even going to necessarily think, well, this couldn't be dementia. They're 45 or whatever. And that is why it is so important to see, okay, let's look at the factors. Is there a family history? Is this person in a group that has a higher, like the groups are Hispanics, African Americans, and women? And actually, the early onset that I've seen when I worked in a assisted living with a memory care was a white man. But in any event, that's why we want to. You see the things, you see signs that are not normal, right? Something is going on cognitively. So all the more reason, whether it is the person themselves or loved one or both, start journaling and documenting what is going on. Like I said, time of day, date, what's going on in the environment. Sometimes people, and this is not about necessarily early onset, but there's a syndrome called sundowners, and it usually happens late in the day, and there are certain reactions with the people with the disease. So, does that happen because they're tired? Does that happen because the light changes? We don't really know exactly, but it is good to document things like that. So then you take that information, you go to the doctor, you get a complete physical, you do all the blood work, you do the screenings, you talk to the doctor, contact the Alzheimer's Association, get as much information as you can. And the one thing I will say too is get as much information as you can from credible resources. There's all, this is America. There's all kinds of cures out there, and people are selling memory pills and all of this stuff. And there is nothing out there that is gonna change your memory. Now, if you get a better night's sleep, you might be sharper the next day. That's probably true. So beware of where you get your information from. There are other organizations, but Alzheimer's Association is really the gold standard in this field. So I think that's a really good starting point. And so many of the resources are free. So it's scary to make that first phone call. You're giving yourself a gift to do that. So you get information, you take a deep breath. Okay, where do we go from here? That's what I highly recommend.
Okay.
Any other questions?
Yeah, another question. So I'm going to read this carefully. Is the sex difference in incidences greater than would be expected on the basis of women living longer? Does that make sense?
Yes, it's an excellent question. And that's what I thought at first when I heard that statistic. I thought, well, of course, age is the biggest risk factor. Women live longer, duh. But actually, that is not it, because there's a caveat to that. And they have said that even though women do live longer, and we do, even that taken into consideration, women are higher, a greater, they've done whatever calculations they would need to do to see whether that is the issue. And evidently there are other reasons, and they really don't know why. They don't know if it has something to do with hormones or what. And that is one of the reasons. Sometimes when people with this disease, it feels so hopeless. It feels like there's nothing we can do. There's no cure. Maybe some of the medications do help some of the symptoms some of the time. And that is exactly the size of it. But there are things that people can do. They can participate in trial match. You can be a person without the disease and participate in as a control group, or call the number and see, well, what would that look like? What would that feel like? How would I be at risk for anything? What does that mean? And this is the way, the Alzheimer's Association needs two things. They need money, okay, but they also need volunteers for trial match. That's a big deal. And that goes to the studies. They're continually doing studies to see, well, is it this? Is it this? Is it this? just to that question about the female difference. According to the Alzheimer's Association, even with the women living longer, it still factors out that they still have a higher rate. So they don't know why.
Okay. And we do have a few more questions. I know we're past our time, but I do want to try to get our questions addressed
Sure.
for our attendees. So 2 questions I'll kind of wrap into one. Can you address anger moods? And also, what is the term sundowners that you previously mentioned?
Right. So that's probably a whole different presentation, but I will talk about that. And part of the baffling thing about this disease is that sometimes people's personalities change. Not always, and sometimes it doesn't always change for the worse. But sometimes they do exhibit things that you don't understand. And it could be anger, it could be fear, it could be a lot of different things. So when dealing with that, one of the best things to do is to, number 1, to stay calm. Number 2, you want to see if that person is in distress physically. Are they hungry? Are they thirsty? Are they hot? Are they cold? Are they constipated? Do they have a full diaper? What is going on? Because physically, it could be something. What happens is that with the progression of the disease, the patients will lose the ability to connect their linguistic skills and verbalization, and that goes away. So if there is pain or discomfort, they don't have necessarily the tools to express that. So that's number 1. Number 2, there are some things that can help calm people down. Now, it might be different with different people, but for example, we don't need loud noises. We don't need honking horns, things that would be distressing or disturbing mildly to most people. It might be exacerbated for the person with the disease. So you want to create an environment that is soothing, that's calm, classical music maybe. There's some products on the market. One is called, what is it called? A weighted blanket. Now this product was on the market for, actually I saw it for pets. It was called a thunder blanket. And all it is really is a weighted, it's a blanket that's got little quilted squares with something inside that weighs it down, makes it heavy. So a weighted blanket for someone, and it really goes back to, at least I believe it goes back to really primal, because you know, in this country, there's a lot of with babies. So babies are used to being in the womb, tight and warm. They are born, most cultures swaddle their babies. In America, everybody's hanging out and airing out, and that really is part of the reason for colic in a lot of babies. So swaddling the babies tight, warm, cozy. And the weighted blanket has got, you know, similar theory in that it feels secure, it feels cozy. Some of the fabrics out there that are like this fake fur, not fur, I don't know what they call it, but they're so soft and fuzzy, tactile things that feel good. That might make someone comfortable. There is a mechanical cat on the market that I have been told you would think it's a real cat. And the people with the dementia who have those cats, they think it's their real cat. They've done a fabulous job at that. So there's some things that can be done that are comforting. Not everything works with every person. And what didn't work at one time, you can reintroduce. So yeah, the main thing with anger is you don't want to react with anger. You want to be calm. You don't need to invalidate. You want to assure the person that they're going to be okay and that you're there for them. You don't make promises that you can't keep, but you can tell them you're there for them and they're safe and you're safe, and reassure them. And with love. It's very hard to do, but really with love, because they're disturbed, they're frightened. Something is obviously disturbing them. So.
Okay, thank you. And the last question that we have is, can you touch on any thoughts about other types of dementias, and are there other or good resources out there for people to look into about them?
Yes, there are many different kinds of dementias. And on the Alzheimer's website, there's a glossary actually of many kinds. Now, some of those specific kinds have associations that you could go to as well. And I'll give an example. There's Parkinson's dementia. Well, and there is the Parkinson's Foundation. So if someone has Parkinson's dementia, I'm going to recommend that they, yes, tap into the Alzheimer's Association, but also look at the Parkinson's Foundation as well. They probably have more very specific things regarding that. So that's how I would go about it.
Okay, great. Anything else that you'd like to share as part of the presentation, Ellen? No, we're about 13 minutes past, but we still have a good portion of our attendees on. So
okay, well, thanks for being on. Here's the big takeaway. I would like to leave with anybody who's dealing with this disease, Alzheimer's or dementia. Please educate yourself. That's the best thing you can do for yourself and your loved one. Learn what you can, tap into the resources. They are there. It's scary to try to open that lid because you don't know what's under it, but really what's under that lid are people who have walked in the path before you and can give you some insight and help you walk through this journey. I think that's really, really important. And it will only make it easier for you and with the person with the dementia. So alz.org is the easiest website in the world. So please take advantage of that. It's out there.
Well, thank you very much, Ellen. It's just a pleasure to have you back. Really important information. And thank you for being a volunteer for the Alzheimer's Association with all the other work that you do. And I want to touch on that at the very end. Just briefly, for everybody that's a part of a lot of our webinars, and for those that are new, I'll be sending out a video of today's webinar for yourselves as a resource, along with a little bit of other information in my post-webinar feedback or follow-up that I always send out. As part of our webinar series, next Tuesday, we'll be discussing Medicaid asset protection planning with elder law attorney Lindsay Moss of our firm. And next Friday the 6th, we'll be talking about what families need to know about planning for a loved one with special needs, always a very popular program. It's our global discussion about special needs planning. That's going to be with our managing principal, Steve Elville. So we hope we can join us for those presentations. And we have other presentations coming up in August as well. So please reach out to us. Please reach out to Ellen if you have questions about today's topic or anything else that we can be of service to you about. And I want to ask Ellen, just as we leave here, you do so many things. You're a certified dementia practitioner. You're the owner of Senior Placement Navigators, and you're a senior specialist. How else can people reach out to you, as a resource? What else can you do for people here on the call?
Well, I'd be happy to, if anyone has questions about your own situation, I'd be happy to take your calls. My number is 443-562-9820. What I do, my business Senior Placement Navigators, is I help families navigate the journey of transitions. I am in the role of an advocate to the senior and the family, and whether they need that now or they'll need it down the road, I really help them with what the options are available financially, logistically, what would be the best fit or some of the best fits for the senior, because most people who are very intelligent, very educated, they're not terribly familiar with senior living, this field. And there's a lot of lingo and there are a lot of terminology that it's just, it's confusing. It's confusing. So I work with families in the role to make this all make sense, take away the confusion, take away the stress, and make it easy for them. So that's what I do. So I'm happy to help. I'm happy to take your calls.
Well, thank you, Ellen, and we appreciate you being here and being a resource to us here at Elville & Associates. And so please reach out to Ellen with any questions. So thanks for being part of our Elville webinar series and today's webinar, and we look forward to hosting you again soon. Have a great Thursday and upcoming weekend. It's almost here. Have a great day, everybody. Thanks.
Bye.